Across America, nearly 130 people die per day from an opioid overdose. How bad is the problem? From 1998 to 2018, almost 450,000 people died from an overdose involving opioids. Unfortunately, the problem isn't getting better, it's getting worse. In 2019, the Centers for Disease Control reported that a record 71,000 people died from drug overdoses. And the pandemic is only exacerbating the issue. Record unemployment, isolation, and cuts to essential resources are some of the reasons recovering addicts have cited as factors in the reported rise in opioid use.
As people with a certain kind of personality, they offered them treatments and solutions that was just accepting our incapability on dealing with them as human beings. So you give them alternative opiates and you call this a treatment. You make a chemical lobotomy when you give methadone, Subutex, Suboxone, and you tell them you are being treated. So the families that they are already desperate and they don't know what to do, they try everything and they have to trust whatever the professionals are telling them. You know, they feel that they are, okay, I'm treating my son. I mean, he lives like a zombie, he lives like a robot, but he has no feelings, no anything, but it doesn't matter.
In its wake, opioid addiction leaves countless victims and devastated families. To blame those suffering from opioid dependency is wrong. It's a lesson that Dr. Waismann is teaching the world through his work. A leading expert in the treatment of opioid addiction, his journey started in the unlikeliest of places, as the medical director for the Israeli police over 3 decades ago.
Sometimes I'm asked the path of helping patients. There's no helping patients. A physician should never help a patient. That's our professional. That's what we vow to use science to benefit and to optimize the life of human beings. So all we do at the ANR clinic with the ANR treatment is to use modern medicine to reverse a reversible illness. You don't judge a patient. Our job is to optimize what we see using our knowledge and experience.
His experiences in Jerusalem led Dr. Waismann on a noble path dedicated to finding ways to safely and effectively treat people of all backgrounds who were suffering from an addiction they could not control. The first step in his success? Not judging his patients.
People tend to forget that opioid-dependent patients can be a newborn from a dependent mother that will be born with a withdrawal syndrome. In America, you have a newborn like that every 15 minutes. Somebody using for 3 years, for whatever reasons, doesn't have the same amount of opioid receptors of somebody using for 30 years. So all those treatments out there, they treat like cattle, like they treat everybody like everybody is one. This is just an example. You have your veterans that they, you guys know what they do for us, but they come back wounded and they become dependent, painkillers, and then they're going to be sentenced to live their whole lives like zombies because nobody is willing to reverse their condition.
Dr. Waismann's passion for this work led him to launch the ANR clinic in Tampa, Florida. ANR stands for Accelerated Neuro Regulation, a state-of-the-art approach to treating opioid dependence.
This is a more in-depth understanding of what he wants to do for reversing the opioid dependency. It's not just about ridding the body of the opioids, but it's about changing the receptor opioid balance in the brain, which is really where all this starts. We believe the less you use, or the theory of use and disuse, just like with muscles, they atrophy, they involute, they become inconsequential, irrelevant in this process. So that's the process that we entertain, that's the process that we define, and that's where we get ANR.
Since the clinic's inception, ANR has treated over 24,000 patients. Whereas other methods have failed, ANR has succeeded. Why? It focuses on the biological root of opioid dependency.
ANR stands for Accelerated Neuro Regulation. neuroregulation or neurostabilization or neuromodulation is a therapeutic goal, is what we want to achieve. So our job is to repair the endorphin system, to stabilize the endorphin system, and we do that within 2 days, 3 days at the most, in a hospital, medical, modern facility. And then what will be left to the patient is to optimize the system. So it is what it is. Any opioid-dependent patient that will be treated by ANR will have their endorphin system repaired, number one. Second, stabilized, and you have guidelines on how to optimize it.
I was treated as a normal human being up until I was around 19 years old. I got addicted into the drug scene, and next thing you know, I got involved into the criminal justice system, spent years in and out of jails and institutions, and I've been to 17 rehabs. I've tried all sorts of wacky different treatments, and it's been 10 years of being defined as almost subhuman. But ever since I've had ANR, I've started a great sales job at a company, and my performance has gone through the roof. If my boss was here right now, he would tell you it's like I'm a new person. And everyone says there's clarity in my eyes, and it's back to the old me. They truly have given me my life back.
Opioid addiction has shown it does not discriminate. It affects those young and old, rich and poor, male and female, and people of all races and ethnic backgrounds. Traditional methods classify the problem as a chronic relapsing condition. Therefore, the standard approach has been harm reduction. ANR has proven this attitude to be incorrect. Updates in medical technology and our understanding of the neurological system has changed the belief of opioid dependency being a chronic illness. We now know it to be a totally reversible medical condition. At ANR Clinic, they are actively taking necessary steps to share Dr. Waismann's knowledge and experience with high-quality physicians in order to allow patients to enjoy the benefits of modern medicine.